Akit Patel is a specialist prosthodontist based at Perland Specialist Dental Centre in Eastbourne, East Sussex, where the patient demographic is characterised by a high proportion of older patients. Akit has joined us to discuss the challenges he encounters when treating older patients and the types of materials he relies on to help him in challenging cases. Welcome, Akit. Could you start by telling us a little bit about your current practice?
My name is Akit Patel, and I'm a specialist prosthodontist working at Bupa Perland Specialist Dental Centre in East Sussex. I spend the majority of my time here, 4 days a week, treating patients, and the rest of the time lecturing for UCL at the Eastman Dental Institute, the University of Bristol, the ITI, Straumann, and also do some consultancy for a few companies. And I currently sit on the Bupa Dental Care Advisory Committee.
And what is your current patient base at your practice?
I treat majority all adults, and these are virtually all retired, so these are ex-Londoners, and so they sit in the older age bracket.
What then are the particular challenges in this age bracket? Do they present with root caries, for instance, which is more common in older patients?
Amongst the patients I see, obviously the older cohort of patients, there are often multifactorial factors causing root caries in this age group. So these can be diet related, suboptimal cleaning, which is related to their ability to clean, so their manual dexterity. Some of these patients have got visual impairments; they can't actually see, the sites that need to be kept clean. They often sometimes have compounding xerostomia or polypharmacy. And often there is limitation in what you can change in terms of habits with these patients, because a lot of the times they have got just iatrogenic causes.
And so with all those challenges, what's your clinical approach to treating root caries and also preventing it?
I would treat such lesions with the most conservative approach. This would be either using a minimal intervention with a view to trying to arrest the caries using a combination of a regular application of chlorhexidine and fluoride varnishes, and I prefer a varnish with a TCP ingredient, so tricalcium phosphate. The utilisation of fluoride mouthwashes and GC-MI paste in the daytime, and then using either high concentration fluoride or standard fluoride toothpaste. And to assist with the home care, I would often make the site more cleansable by reshaping any margins that would otherwise inhibit the action of these medicaments. The second approach, obviously, if we're unable to reverse the caries, then we'd have to intervene with an operative restorative approach, which would include removal of the caries, either fully or partially, and then restoring the cavity with either a high viscosity hybrid glass ionomer like EQUIA Forte HT or a composite like Genial Cord. However, root caries doesn't always appear to make it easy for us, and classically they start interproximally, extending subgingival. So we want a material that we can work in such environments where we can't isolate with a rubber dam. I mean, I would still isolate the area with a retraction cord, using astringent retraction paste to get hemostasis, but it's still a struggle and difficult. And therefore, we want to use a material that can work as a single bulk fill, as we need to get in and get out with the least number of steps as the clock is ticking, either from a patient perspective due to their tolerance or at the risk of moisture contamination. Hence why EQUIA Forte HT would be the material of choice and be the perfect choice material for these situations.
And would you use EQUIA Forte HT as an alternative to amalgam now that it's being phased out? And also on that note, do you see the move away from amalgam as a positive thing?
I'm very pleased with this move because whilst I've been trained on using amalgam, intensively, I love working with amalgam. It doesn't offer any advantages to the tooth. And so realistically, with current available materials in present day, the best alternatives would be, to use a high viscosity glass ionomer or a composite material, whether it's injectable, heated, or in a generic paste form. However, composites are much more technically sensitive. They require isolation, ideally with a rubber dam, more time, more steps. Therefore, they can be way more challenging and stressful in getting it right. For me, a composite would always be first choice in terms of strength and aesthetics. However, where there is difficulty in getting that moisture control, then the high viscosity glass ionomer would be a great alternative.
I think you've used GC glass ionomers in your practice for many years, haven't you? Could you explain why that is?
I've used glass ionomers for years. I first started using one of the glass ionomers called Fuji 9 GP back in 1998, so about 25 years now. I still remember mixing the powder and liquid, to get the optimum mix and kind of paste. And obviously we've moved forwards now with capsulated form, capsulated materials. And I've always trusted GC glass ionomers, especially back then and still now, because, they are the market leaders with the technology. They're constantly developing this type of material, and we can see how far they've come. And EQUIA Forte offers such, super high mechanical properties. Like with anything, you trust a brand, and if they can help you to deliver success results, then why change?
Absolutely. And so finally, could you sum up why you would recommend EQUIA Forte HT to other clinicians?
This material wins due to its super strength because of the glass hybrid technology. It's easy to use, sculpt, adapts well to the margin, and provides that optimal seal, which is paramount. Should they fail, then they always tend to fail safe without causing biological damage to the tooth. And the main advantage for me is the quality of the bond, its natural ability to chemically bond to the tooth. Nothing beats it out there, and hence why it is one of my go-to as a core material for conventional crown and bridge work. So all in summary, it's one of the top materials that we have, and it basically works because of its unique chemistry.
Thanks so much to Akit for his time and valuable insights into his clinical approach for challenging restorative cases. To find out more about GC's EQUIA Forte HT glass hybrid and its indications, visit gc.dental/Europe/EQUIA Forte HT.